Outcomes are our way of talking about quality. Quality in healthcare has been a word that's the actual use of the word quality has created more problems than solutions in healthcare, because the definition of quality as it's been used in the field has been really incorrect. So the first thing we've got to do is get clarity and sort of unanimity of focus on that core goal. Now, if you then focus on that goal, you need to then think about, are we organized to deliver care that maximizes value? Are we measuring it so that we actually know whether we've delivered it? Have we got a payment system that syncs up how we get paid to whether we delivered value? Have we thought about our health systems in a way that's aligned with value? Do we have the right service in the right location? Are we doing simple stuff in an academic medical center and complex stuff in a local community hospital that really doesn't have the talent to do that? Once you sort of realign and start to understand, well, actually value is the central goal of any healthcare organization and any healthcare provider, then you have to ask yourself whether all the other dimensions of how we go about delivering healthcare actually are aligned. We believe that outcomes are the true measure of quality. How well did the patient actually do relative to how much did it cost us to deliver those outcomes? And so value-based healthcare says that's the goal. If today you've improved outcomes without escalating any cost, you've succeeded. Today, if you've delivered equally good outcomes more efficiently, you've succeeded. Today, if you didn't do one of those two things, you failed today.
Today I'm going to walk through the difference between fee-for-service and value-based care, and why it's so key to keeping all of us healthy. Now, let's talk about why this is important to you. Costs are continuing to rise, and the responsibility is shifting onto the employees. And as you can see, we are not leading the world in outcomes. This is a very big problem, with lots of different factors affecting it. Today we're going to talk about one key feature. How do we reward the system? How do we pay for things? Today's model is fairly simple. It's what we call fee for service. You pay a fee every time you receive an aspect of care. This type of reimbursement model ends up rewarding one thing: more volume. When we're incenting this type of behavior, what do you think ends up happening? So, who gets the short stick? Unfortunately, it is the two groups that pay for the service: the patients and employees, and the employers. Now let's talk through the emerging reimbursement model, value-based care. This is when payment for delivery of care is tied to the actual quality and outcomes of that care. Here is an example of a bundled surgery on your shoulder. All of the following is included on one price for the patient, the employer, and those that are taking care of them. Why should we change to this model? First off, this requires coordinated healthcare, better for the patient. Second off, they get more information, making them more engaged. And finally, the price is much more transparent. Everybody knows going in what the price is going to be. Here are just a few of the many examples of this being successful. Now you're probably asking, what has this got to do with me? If we want to make any progress, we have to change the one thing holding us back, our reward system. Let's reward value.
Hello everyone. Today I'm going to present our proposed solution on the problem statement value-based healthcare for Optum Stratathon Track E. I'm from Team Status 200, and this product essentially tries to achieve value-based healthcare using a machine learning classification and early intervention, which helps in early intervention. by profiling user based on their details like heart rate, glucose levels, etc., and other symptoms that they might face. So let's just go through it. If I log in here, so as you can see, there are multiple fields which are tracked for the user. So on a broader scope, we hope to achieve these fields like temperature and blood pressure using remote devices like smartwatches. There is another section for how the user is feeling today, wherein they can select symptoms. For example, I will select two of these. And if we click on check, it uses a classification model to determine based on the symptoms what ailment or problem the user is suffering from. So as we can see, the user has acne based on these two symptoms. The causes for acne and its prevention are also listed. So obviously this cannot replicate the diagnosis by a doctor, but it gives us a good idea of what users should focus on. Other than that, we also have fields like exercise or activity per day, which a user can track. And also, after predicting this disease, the user can also schedule appointments with doctor based on what the result is.